Thanks for catching that. Hi, everyone. Okay, so back to our lesson. So we're talking about sharing the screen. We are talking about teaching kids with emotional behavioral disorders and my awesome life. So I moved to this district and I interviewed for a job, and the principal said, it's a little resource, maybe a little behavior. And I'm like, eh. So I'd only taught kindergarten, remember that. And I was young. And so he said, okay, so he hired me for this job. And he said, now you have to go to this training for 2 weeks, and she's going to tell you how to run your classroom. I was like, oh, okay. I go in this room, and we're making rules, and we're making these big poster boards. And there's a, what was it? It was a classroom management play where kids move from level to level based on their behavior. And each level had a different, it was a leveling system. And each level had different privileges. So if you were on level 1, you had to stay in your desk. You couldn't get up, couldn't breathe. No, there were like these intense rules for level 1. And then there was what they called an impulse control sequence, where you gave kids a warning. And if the behavior didn't change, then you gave them a timeout, which just meant put their head on their desk. And if the behavior didn't change, then they moved to isolation, which we don't use anymore. It was a long time ago. So while I'm sitting in this training, it's becoming really clear that these kids are going to have some serious behaviors, right? It's not a little bit of behavior. So I go in the classroom, and there's 5 little kids with emotional and behavioral disorders. It was hilarious. And I really, really fell in love with those kids. So that's how it became that this was my favorite class to teach. One of the kids had an intellectual disability and had explosive behavior. He also lived under the bridge with his dad in a truck. Another one really had psychotic behaviors in that he talked to the chair beside him, literally no playing around. He really heard voices and saw things. Yeah, so that was pretty much it. The others were behavior disordered. So I'll tell you more about them as we go through when I think about them. But the fun part was that class, it took me about a year to get that class under control. And then, so I was in there for a year and a half. And then the middle school teacher class that was similar to mine, they ran 4 teachers off in 1 year. And I volunteered to go over there. Check me out. I was like, I can do this. Because I was so bored. I had these little kids. They were doing so much better. I had worked them out of my class so that they were in gen ed settings. And so I went to the middle school with kids that had been held back multiple times. So they were like between 14 and 16 probably. Most of them had been in jail more than they'd been out of jail. It was a blast. So that's how I became a counselor shortly thereafter. So let's talk about what it means to have an emotional behavioral disorder. So when do you think people first recognized that kids were really struggling with behavior, that was even a thing, or that mental health issues were a thing? What's your thought, other than what the slide says? Think about in history. Like, I don't know. Think it was easy to notice if a kid had an emotional or a behavioral problem? Emily, no?
Probably when like traditional methods like weren't working for a certain kid. Like if everybody else was behaving one way and then like this one kid wasn't and nothing was working, like that's when they kind of figured it out.
Something's happening, yeah. It's funny when you think about disciplinarians or discipline techniques that have gone on over the years. It's interesting to think that as far back as 1547, there was an institution for people with emotional behavioral disorders, because that's what they did, right? We don't know what else to do with these people that are really struggling. And then in between 1700s and 1800s, Benjamin Rush was the father of American psychiatry. How'd you like to be the father of American psychiatry? He probably didn't even know it in his lifetime, huh? Anyway, so he started looking at humane methods of caring for kids that had behavior problems. And then in the late 1800s, the first public school class opened. So let's talk about that. 1800s, the first public school class opened for children with emotional and behavioral disorders. Did they have to go to school then? No. Did you have to let them go to school then? So when was the law passed that said kids with disabilities had to be allowed to come to school? What year was that? You guys are in a bind. There's only 5 of you. I know the answer.
1975.
Good job, 1975. And what was the name? Now think before you answer. What was the name of the first law before it was reauthorized multiple times?
Was it just idea without the I, like the second I?
Before that. That was one of them, but the very first one was the one before that.
BAPE or least restrictive environment?
Google
One
it.
of those. I'm not sure then. I don't remember.
I know. That's why I was saying. You're going to see that question again. Let me just say that. Erin, what is it?
Wasn't it EHA, like the Education for Handicap?
Yeah,
Act or
Education
something?
for All Handicapped Children Act. So that was the very first. It was passed in what year?
1975.
Good, 1975. And so then it was reauthorized multiple times, like Jasmine was talking about the different names. So tell me, IDEA is what it is now, and it guarantees that kids with disabilities have the right to a
Free and appropriate public education,
in the
least restrictive environment.
good job. Those are important concepts. But in the late 1800s, kids didn't have to go to school, nor did we have to let them come to school. In 1957, Leo Kanner wrote a book called Child Psychiatry. He's also was the first person, let me not say that, who started talking about autism, I think, almost positive. And then in 1960, Nicholas Hobbs initiated Project REED. So we're slowly but surely starting to talk about how to educate kids with emotional and behavioral disorders. So in 1961, Eli Bauer developed a definition for emotional disturbance, which is what's used to this moment, to this day. So in the law, how many categories of special education are there? Drum roll.
13, but 14 in New Jersey.
Good job. 13, but 14 in New Jersey. And one of those is what we're talking about today, which is emotional disturbance. But you'll hear me say emotional and behavioral disorders because there was a movement in the field that pretty much said emotional disturbance is like a crazy thing to say. Ironically, right? It's just rude to tell somebody that they have an emotional disturbance. Not only that, but it doesn't really meet the criteria for the kids that we work with. So I'll talk more about that when we look at the definition. And in fact, Eli Bauer said that was not his goal for it to be used the way it is, but it is, and it has not been changed regardless of how much we try to change it. In 1964, there was a study done on the effects of teacher attention on preschoolers' social interactions with peers during play. And then in 1999, IDEA removed the term serious. So it used to be serious emotional disturbance, and now it's emotional disturbance. How would you feel if somebody told you you had an emotional disturbance?
Self-conscious.
Self-conscious, for sure. What else would you think if someone said, I have an emotional disturbance? Put it on. So Emma's here. Look how many of us are in class today. You want to see my new mask? She said you should see my new mask.
Is that right?
I think.
RBG.
It's RBG. Cool, huh? Cool. Do y'all know Emma? I talk about Emma. Emma, say hi. They're waiting for you. Thank you. Some of these are yours, whatever you want.
These are ugly.
Okay, well, let me teach my
Sorry.
class.
Okay.
What is this, Zoom University? People just don't walk in your class when you're standing up in front of a class. I like them. It's really pretty. Thanks. Shut the door. What am I even saying? How do you feel if you have a serious emotional disturbance? Yeah, uncomfortable, awkward. Like, are you serious, right? But what if someone told you you were depressed or anxious? That'd be okay, right? Most of us are these days. But emotionally disturbed. So one time One time I was counseling a student and I really wanted him to go to his IEP meeting. And I wanted him to talk in his IEP meeting. So do you guys remember how many people are in IEP meetings? Or maybe some of the people that are there? Tell me some names or some positions that are there.
A social worker, maybe?
Sometimes a social worker, yeah. Sometimes a social worker. Who else?
Parents,
Parents.
the kid.
If the kid wants to be there, or can we allow him to be there? He always should be, but yes.
A
Teacher.
therapist, maybe like
There.
speech or like physical therapists.
Yep, therapist. Teacher, Sabrina, what kind of teacher?
I don't know.
Gen ed and special ed, both
Oh,
of them.
okay. Those people.
What else? Who else? So you get the idea that there's this big table. It's usually at a conference room. Have you ever been to a conference room in an elementary school? Or yeah, big table, big chairs. Everybody's fancy. Sometimes, and a table full of people. And so I talked to him about talking about what his needs were, and he sits down, and so we go through the paperwork because the IEP is a lot of paper, even though it's really supposed to be a program, not a plan. So we get to one part, and the diagnostician said, and so Craig is carried in special education as a student with emotional disorder. Yeah. So my student, who I adored and had worked really hard to help him learn to handle his behavior, did what when they said that? He acted like he had an emotional disturbance. He stood up, he slammed his chair, he said, "I'm not crazy, what are you talking about?" And he stormed out of the room. So there were a couple of things wrong with that situation and a couple of things that it should help you understand. Number one, the term emotional disturbance needs to change in the law. It hasn't, but it needs to. Number two, I should have prepared him for that, right? Before we walked into that classroom, I should have, as his counselor, told him, this is what they're going to say. This is what it means, right? But I didn't. But at that moment, I really started looking into, why do we say kids are emotionally disturbed? It's just crazy. But it's good, though, because in '97, they removed the term serious. It's a really interesting thing, this term. So what about kids with emotional and behavioral disorders? This is what we know. We know that they're difficult to teach, and they, so we always say they challenge teachers and teachers challenge them. Make sense? Compared to their general ed friends, their typically developing peers, they experience less success. So why do you think that a behavior disorder, even if you think about the emotional component, so what if a kid's depressed? How is that interfering with his academic performance?
He's like, just because of having depression alone, they're more likely to like not succeed, like doing their work, having the motivation to even participate or fill in their own, like just doing regular classwork is already at a lower chance, or like submitting homework or even trying on tests and things.
Exactly. So motivation levels are down, even coming to school. So kids who are depressed really struggle. They have a lot of absentee issues, right? Because they don't want to be there. Same thing with kids who are anxious. So it goes both ways, right? So not only are they struggling with behavior, they're also struggling with their academic performance and with learning. They have a greater academic deficits than students with learning disabilities. So if I'm depressed, or if I'm acting out in the classroom and people are sending me out of the classroom all the time and I'm not learning, then there's going to be a gap. Remember we talked about gaps in achievement? So the gap, the more instruction you miss, the larger the gap, which is logical, right? If I'm not learning, instead I'm throwing pencils across the room and you're sending me to the principal's office, I'm not learning anything. So then the gaps happen. And that really just kind of, we call it the school to prison pipeline, because the more they don't learn, the more they're going to become engaged in things that they shouldn't be engaged in, right? I talked to you a minute ago about students that I taught that had spent more time in jail than out. They're also prone to have more drug issues, right? Substance abuse issues. As adults, they struggle with unemployment, interpersonal relationships, and they need mental health services. They need mental health services even in schools, right? So one of the things that I do research on is school mental health services, because we provide mental health services in schools, then we can address a lot of these issues. Let's see if this works. Can't even get to it. Moving right along. So here we go. So this is what Eli Bauer said emotionally disturbed was. A disability, I'm going to read to you. I want you to listen to each little characteristic because it's really funny. A disability that's characterized by exhibiting one or more of the following 5 characteristics. The first is an inability to learn that can't be explained by intellectual, sensory, or health factors. Okay, so I'm struggling academically. The second is an inability to build or maintain satisfactory interpersonal relationships with peers and teachers. Okay, so I'm fighting with people. That's what you see a lot in kids with emotional behavioral disorders. Inappropriate types of behaviors or feelings. I always hated that. How can you have an inappropriate feeling? Are your feelings inappropriate? No. So it took me a while to realize that they're talking about psychosis, not just kids that are angry all the time. Under normal circumstances, a general pervasive mood of unhappiness or depression, and a tendency to develop physical symptoms or fears associated with personal or school problems. Okay, I'm good. All that makes sense, right? So it looks like we're looking at acting out behavior, we're looking at depression, we're looking at anxiety, we're looking at social problems, right? Kind of all goes there. But then the characteristics must be demonstrated over a long period of time, okay, and to a marked degree, and it has to affect the educational performance. So with every disability category that you look at, in order for kids to qualify for special ed services, it has to interfere with their academic performance. Okay, we're good. And then it includes schizophrenia. This is where it gets crazy. It does not apply to a child who is socially maladjusted unless the child has been found to have an emotional disturbance. So I just defined emotional disturbance, and I included the word emotional disturbance. And I told you that the kid can't be socially maladjusted. So what in the world does socially maladjusted mean? What do you think it means? Three joined us. So there's more of you to answer my questions. We're glad you joined us. What do you think it means to be socially maladjusted? Take a shot in the dark. What do you think?
Someone lacking like social skills.
Someone lacking social skills. Yeah, you would think that.
They're just like somebody that like acts out in public settings. I don't know.
Yeah, okay. So someone that acts out in public settings, which is pretty much the definition of a kid with an emotional disturbance. So what they intended, we think, because no one's really sure, but what they intended to say was that kids who were sociopaths, who were criminals kind of thing, right? So a lot of people interpreted that to mean with a diagnosis of conduct disorder. So always in Texas, they would say, oh, no, he has a conduct disorder, he can't be emotionally disturbed. What in the world? So it was kind of like giving up on kids that were having conduct problems. So do you know what a conduct disorder is? Okay, someone look it up and read us the definition, please. Google it. What is a conduct disorder?
It's a range of antisocial types of behavior displayed in childhood or adolescence.
Yeah, so it's antisocial behavior. So what's an antisocial behavior? What does that mean? Google it.
I think it kind of like depends on culture. like everything else we're talking about. But
Good point.
I guess in like American culture, like in my opinion, I guess just, being or not really interacting very much with peers, and just being by yourself a lot.
Like withdrawn.
Yeah, like withdrawn, yeah.
Emily?
Yeah, we talked about this in my Gen Psych class. So this is going back a couple of years, and when we my teacher asked the same thing, and we had those kind of similar responses, and she got so upset with us because she was like, "No, it's more than that." She was like, "No, it's like being completely twisted in the environment, and you're doing the exact opposite of the rest of like social norms, and to do things that are like you said, like twisted." And so
Did you ask me what twisted meant?
yeah, I was just like, okay, instead of just like you said, instead of just being like, I guess like socially withdrawn, but it's like socially withdrawn times like 100.
So it means things like setting fires, killing animals, breaking into buildings with a weapon. I mean, they're criminal type behaviors, and even worse than that. And it also means that people don't have a sense of remorse after those things happen. That's the idea. But, so if we say a child with conduct disorder who kills animals, we're not going to provide any extra services to him at school because he doesn't qualify for special ed. He's not emotionally disturbed. Really? Does that make sense? Absolutely not. So a majority of people kind of just move on and don't pay a lot of attention to that. But what's really interesting is that in New Jersey, that's the 14th, or the extra category of special ed is socially maladjusted, which when I moved here, I thought that was so excited. So I was like, oh, wow. So we're going to include kids who are socially maladjusted, whatever that means, in special ed. So I asked a special ed director, I was like, so tell me about these kids who are socially maladjusted. And she said, oh, we don't use that. Really? But it is a category of special ed in New Jersey. I would really like to look at state level data and see if they have anybody with that diagnosis. Because the bottom line is that kids who are emotionally disturbed, a lot of times they're socially maladjusted, right? So that's why the definition's all wonky. That's my word. Should be changed. And along those lines, the National Mental Health and Special Ed Coalition said, okay, let's use this definition. So this is the one that I tend to gravitate to, even though it's not the official diagnosis or the official category in special ed. So it means a condition that includes behavior or emotional responses in school different from age-appropriate cultural, good job, Emily, or personal skills. Or ethnic norms. So you can't just say this behavior is out of line. If it fits within the child's culture, that makes no sense, right? The school performance is affected adversely, and that school performance includes academic, social, vocational, and personal skills. It's not temporary or an unexpected response, so it does last for a long period of time. The behavior is consistently exhibited in 2 different settings, so you can't be emotionally and behavioral disordered at home and not at school. It's not a thing. Something's going on in the environment if that's happening. It's not a temporary, I said that. The condition is unresponsive to direct intervention in general education. So remember, we talked about the triangle. Didn't we talk about the triangle? One side was response to intervention. The other side was positive behavior interventions and supports. So if you provide all 3 tiers of service to a kid and the behavior doesn't change, then he's likely to be emotionally and behaviorally disordered, right? So it includes schizophrenia, affective disorders. Do you know what affective disorder is? What does affective mean? It's a mood disorder. So your affect. So a mood disorder would be an affective disorder. Anxiety disorder or other disorders of adjustment or conduct. We like that definition. So when I'm long gone and you're a special ed teacher, you're going to advocate for the definition, for the category to be changed. Got it? All right. So there's at least two different types of emotional and behavioral disorders. We talk a lot about externalizing behaviors and internalizing behaviors. So what do you think externalizing behaviors are?
Things that the person does, like outwardly,
Mhm.
like screaming, crying, things like that.
Right, exactly. So it's external. It's aggressive behavior, throwing tables, throwing garbage cans. That's always my favorite. It's funny. Examples include a high level of irritating behavior. That's impulsive, distracting, persistent, aggressive. Common problems include hyperactivity, aggression, delinquency. Do you think that kids with ADHD often have emotional and behavioral disorders also? Or what do you think? How does that go together, EBD and ADHD?
I think that maybe for people with ADHD, they might develop, if they're having like a hard time with it, like especially like socially, maybe they get frustrated and maybe develop some sort of EBD,
Yeah,
without realizing it.
right. I mean, you could see depression, anxiety, aggression, even for kids that are really struggling and not being successful very often. Internalizing behaviors are the other category that we typically talk about. So we talk about externalizing, we talk about internalizing. What are internalizing behaviors?
Things that are more like happening in your head versus in your outward behavior.
Yeah, so it's more about when you turn in on yourself as opposed to turning out on the world, right? So socially withdrawn, anorexia, bulimia, depression, anxiety. What do you think is more common in males, externalizing or internalizing?
Externalizing.
Externalizing. And in females?
Internalizing.
Good job, Patrick. How do you think that is? Why do we think that girls don't tend to be super aggressive?
It often gets like shut down at a younger age because there's always that boys will be boys mentality and they can get away with a lot more stuff.
Yeah. So a lot of it has to do with socialization, what we do as a society, how we treat boys and girls differently. That's one thing. The other issue is we don't really know other than the socialization process. Could be expectations, right? It could be like if a girl's acting aggressive, you're not going to think she has an emotional behavioral disorder. You're going to, like, I don't know, think that that's really odd. Maybe it's the moment. She's sad. She's depressed today. I mean, she's whatever. She's angry today. And I think people don't pay attention as much. All right.
We can't hear it.
Okay, remind me how to do that.
You have to like unshare your screen and then like allow the audio or something. Well, actually, no.
You're getting it.
I think there's a way to like share your computer audio if you're sharing your screen. There should be a button at the bottom of the Zoom call.
Okay.
I think anyway.
Button at the bottom of the Zoom call. I found it the other day. Help me. Do not see it. Here we go. Audio settings. Nope. Okay. We did find it. Interesting. No idea. Maybe it's in the share. No. I guess I can turn it up louder. Let's try. That's so weird. So there's a whiteboard on here? Okay. I'm just going to turn it up louder. Unless it's here. Nope. Okay. I'm going to leave the room because it's going to be so loud. Tell me if you can hear it.
You know.
Oh, okay, y'all. No? Okay. Maybe we don't watch it. Maybe it's up here.
I thought I heard him starting to talk like when you started the video, but then when you set it back to the beginning, I was no longer hearing it.
That's weird. Not talking there.
You know,
Now he's talking.
when I was a young kid, my mom used to always
You
tell
can
me,
hear it?
did you brush your teeth before I went to bed every night? Actually, who am I kidding? When I go back home, my mom still asks me if I brush my teeth every night before I go to bed.
There it is.
I'm like 21.
Yeah.
But a few years ago, my mom started to ask me a different question. Hey, did you take your medication before I went to bed? I take lithium before I go to sleep, almost every day. I took it last night before this conference too. Lithium. I know what that is. That's the lithium-ion battery. It's what makes laptop and cell phone batteries, right? But why is it in my body? During the second semester of my freshman year, I was a completely different person. I hated myself for weeks and weeks. Nothing gave me joy or happiness. I had slowed cognition. I started to stutter in class. I saw no purpose in anything, no worth. I barely ate. Day after day, I even had suicidal thoughts. Living was painful and meaningless anyway. Why live? One day in my dorm, I almost lost myself to my suicidality. Gasping for life, I then finally decided I need some help. I called my dad, who immediately told my mom to fly over here from Korea and take me to a psychiatrist right away. I was diagnosed MDD, major depressive disorder. Although recommended to be hospitalized, I ended up just staying in my room instead for 4 months. I was on a medical leave. Depression was not, I had a really bad day, I had a really bad week, but it was, I'm worthless, and for my family, I'm clearly better off dead. They'll be much more happy when I'm gone. For 4 months, every moment, I was awake. Depression was more painful than the time in the hospital where I broke my clavicle while I was snowboarding. That's the closest reference point I can think of in terms of physical pain so far in my life. However, soon I learned that my DSM diagnosis was not of major depressive disorder, but actually bipolar disorder. Bipolar disorder includes a manic episode in addition to the depressive episode. In mania, I almost didn't sleep. I talked fast, I had countless world-changing business ideas. I was arrogant, and I was on a ridiculous buying spree. I drank and smoked in parties every night with different people for 40 days and nights straight. My friends and family thought I was going crazy, but just on the other direction. Slowly, I realized that I was very abnormal. My psychiatrist told me that I was manic, and then taking the lithium might help me prevent future mania or depression if taken regularly. for the rest of my life. I then promised myself to be more stable, and later on decided to return to Penn 2. Now I've been taking lithium for 3 years, but first, in secret, what do I say to my friends? I hid my pill bottles from my roommates. When I was going to therapy, I would just say, I'm going to buy something from the bookstore, because the bookstore is right next to Penn's counseling. But last winter of 2014, a total of 6 Penn students ended their own lives over a period of 15 months. One after another, it reminded me of my own painful and dangerous suicidality when I was a freshman here. Hearing that news broke my heart and brought me to tears. I wanted to do something. I wanted to do anything I could in order to reverse this trend and address this issue, because I will never forget how much pain I was in and how close to actual death I went to. After weeks of thoughts and prayer, I first tell my close friends about my past history and current condition. And then I decide to share to the Penn community. I start from a few hundred likes on my Facebook, and views on YouTube, and notes on Tumblr, and shares on articles featuring that post. I thought it was crucial for students in distress to reach their close social networks, whether it be their friends, their parents, their psychological or psychiatric services if necessary, without much stigma. When your teeth hurts, you think of visiting a dentist or chewing gum from Spencer Penn. When you're suffering mentally or emotionally, however, counseling or therapy is not really one of your options in your mind. I experienced and witnessed some other coping strategies common in college: sleeping in, watching television, eating, binge drinking, smoking, drugs, hookups, or even just working harder to get a better results as a coping mechanism for your stress. Dental health is an acceptable topic, but why is mental health sounding very strange? Wait, aren't you just sad? Aren't you just going through a stressful, tough time? Aren't you just depressed like everybody else? Here's a problem. The same word has 2 different meanings. Hey, how are you doing today? Oh, actually, I'm feeling really depressed right now. What does that mean? The same word depression could either mean unhappiness or clinical depression. Naturally, it's easy to downplay what could be a medical condition into just being sad or weak. Some could just say that my suicidality when I was a freshman was just an early sophomore slump. I was just, common slump in college, an identity crisis. Well, I'll give you that. Being right in between adolescence and adulthood, college is actually a crucial stage of self-identity formation. My prefrontal cortex, which guides my emotion and my decisions, is not even fully mature yet. But under excessive and unhealthy self-pressure or parental or societal pressure, students often, and they actually do, create harmful life habits for themselves, which can trigger a real mental disorder for those with the biophysiological, psychosocial vulnerabilities. Now imagine this conversation on campus. Hey man, what are you doing late night? What are you doing later tonight? Oh, after this bio class, I'm just finishing my lab. I need to go get a good grade on that one. Perfectly normal college conversation, right? But notice this. The have-tos or the need-tos in our daily lives are self-directed, authoritative words. Dr. William Mace, a clinical psychologist in Philadelphia, who's also passionate about college mental health, claims that these can control our emotional life for either or, right or wrong, black or white. Value judgments. You have to do this today, you should do that today, but you didn't, but you couldn't. Now, the same conversation could sound like this. Oh, after bio class, I want to go finish my lab today. I'd like to get a good grade on that one. With this process for myself, I'm trying to make the to-do lists into want-to-do lists. I can recognize my own voice in my life with more want-tos or like-tos. I don't have to. I want to. This helps reduce unhealthy self-pressure for me. I didn't have to deliver a speech today because I'm a mental health advocate, but I wanted to. If you think you don't have a choice in your mind, then you actually don't have a choice in your mind. You don't have to do something ever. Just be willing to be accepting of the consequence of not doing that action. My friends in college, you don't have to finish that bio lab. You don't have to join clubs or that team or rush. You don't have to lose or gain weight or dress nice. You don't have to go to that party on the weekend. You don't have to do well in your classes. You don't have to research or volunteer. You don't have to apply for those jobs or grants or grad schools. You don't have to graduate in 4 years even. And after graduation, you don't have to know exactly what you're doing. We might all want to do these things, but we don't ever have to. Self-care for mental health in particular should be much more prioritized than it is today. Mental disorders, suicidality, takes away too many lives. In fact, after car accidents, suicide is the second leading cause of death for the United States in college campuses. Like I mentioned, it took away 6 student lives in Penn last year. And actually, during this 10-minute speech, 15 more people ended their lives around the world. But just even in the United States alone, last year, over 1,000 college students ended their own lives on campuses across this country. That's at least 2 or 3 students today. How to prevent student suicides? There's no simple solution, I wish I knew. But every student is so different. I'm starting from one at a time, starting from myself. For me, my mental disease breeds self-hate and self-pity. I battle that with my belief that God loves me, I'm so wonderfully and fearfully made, so who am I to not love myself? Last winter, I wanted to share that testimony to my friends at Penn. I'm trying to save my own life every day, save it from excessive self-pressure, stress, and shame. Shame that blocks me from getting that help when I need it from psychiatric or psychological services, because I think it makes me look weak. Last night, I took my lithium, and tonight, I'll take it again too. I don't have to, because my psychiatrist told me to, but I want to, at least for now. I'm not actually hiding it from my roommates in a drawer anymore, or anyone. What's my future like? A life sentence of medication? Well, yeah, perhaps, but still another sacred chance at life. Mental illness is real, painful, reoccurring, and often lethal. If you feel like you need help, please get the help. For me, suicide prevention is not preventing suicides or preventing deaths. It's about living more and finding your purpose and joy in each of your lives. Nobody can be actually saved from death, after all. Lastly, if your loved ones, friends, or family need help, please help them get the help. It's hard to get help yourself when you're at such a horrible place to begin with. You don't need to be a therapist to have a therapeutic conversation. And therapy and medication, they help for sure. But at the end, love heals people. I thank my parents, family, and friends who loved me back then and love me till now. And I thank God I'm still around and be able to deliver a speech to you today. Thank you.
So what are your thoughts? Hi, David. Glad you joined us. What are your thoughts about the video?
I think a lot of people can agree that it probably hits like a lot closer to home than most people expect, whether it's themselves or people that they care about and know.
Yep. I think in today's society, I wasn't listening to the stats that well, but I think we all know someone who is depressed, who has bipolar disorder, who has talked about hurting themselves. So he was in college, which is where you guys are, obviously. So you understand the stressors there, and you probably could relate to a lot that he was talking about, right? Back that up to high school students. Is it the same? Yeah. Yeah, David.
It's similar, but in different ways, I think. You know, a lot of the stressors of college, things like having, maybe 2 tests that your entire grade for the course, often the unavailability of professors, stuff like that tends to not be as huge of roles in high school, but in college you're not 7:30 to 3 or 4 around the clock at school, plus extracurriculars, plus trying to get stuff for your college apps, AP courses. I think it's a similarly intense environment, but in a lot of different ways.
Yeah, I agree. So the stressors are different. The expectations are different. What are the expectations that you see or that you remember or that you know about in high school that really make kids crazy? Not a good word. That really stress kids out.
I feel like in high school, it's a lot more like social pressure, because in college, it's kind of like everybody's focused on their own thing. And like, if you want to go out and party, go out and party. If you don't, you don't. But like in high school, everyone's so condensed into one like school that you kind of like, even if you don't know someone, you kind of know like who their friends are, what their circle is, like what they did over the weekend, and like you're kind of comparing yourself to all of that. So
lots of social pressures, right? What about middle school? I'm sorry, David, do you have something to say?
Oh yeah, I was just gonna say, on top of like to leave off on that point, in by the time a lot of people get through college, a lot of people are starting to formulate and solidify their identity, their sense of self.
Yep.
In high school, no one knows who they are in high school, and that's a crazy sort of path that you have to figure out.
Rough time.
Yeah.
Okay, back it up to middle school. Can you remember being in middle school? Are kids in middle school depressed? Do they have thoughts of suicide? Do they hurt themselves? So what stressors are there? What's different then? It's a really crazy time.
I feel like middle school, aside from like all of the social things that happen in middle school, there's also like puberty.
There's puberty.
So that's just like horrible in and of itself. That
Yep.
causes a lot of issues.
Yep.
So
All kinds of hormonal stuff going on. One day you're 5 years old, the next day you're 12. David?
There are mean people in all walks of life, but I feel like middle school and early high school is the epitome of, let's say, pettiness and bullying.
Yep, I agree. That's when you learn about how really mean the world can be. It's really a sad thing. That's my favorite age to work with. It's hard. It's a tough age, but it's at that point that, yeah, kids are kids one day, they're young adults the next day, and they're so confused about life. David?
I would say that's also probably, more important than really any other time in a kid's life, like that late elementary to middle school, in terms of it's really more than anything else their formative years where they might not, depending on the way their life goes and the way they're treated by the adults and peers around them, they might not experience anything awful in that direct time period, but I think most adult trauma or issues sort of stem from childhood issues.
Exactly.
I think that's sort of where you start to develop, I don't want to say mental issues, but stuff that you got to work out.
Yep. Challenges. What about elementary school? Little kids get depressed. They do. Not as much, probably. We're not aware of it as much. But it's there. A lot of times when you see depression in really young kids, it becomes more aggressive behavior, acting out, as opposed to, depression, withdrawal, those kind of things. Yeah. So I guess the reason that I wanted you to watch that video is I want you to think about, so you guys could be teaching in 3 years, right? And you could be teaching high school kids or middle school kids. So it's really important for you to watch for those signs and to know what to do. David?
When you're teaching at a really young age, like elementary school, like really young kids, how do you differentiate between a kid being upset or discouraged or whatever just because, they really haven't grown very much in terms of maturity versus, more serious, legitimate issues.
Well, first, as a teacher, you don't have to, so that's good. But anything you see that gets your attention, that you start thinking, what is that? It happens too much. It happens on a daily basis. The little girl that cries every day. I did that. That was many years ago, you guys. But when I look back on it, I'm like, dude, somebody should have talked to me. I know myself well enough now to know that it was probably anxiety, but I cried every day through second grade, and no one did anything. So those kind of things you have to start really talking about. There is so much stigma attached to emotional behavioral disorders that you have to be really careful. But as a teacher, it's your responsibility to go to the counselor. It's your responsibility to keep saying, even though you're going to hear a lot, they're just little kids, blah, blah, blah. I mean, you keep data. You mark how many times she cries, or you mark how many times he bites your arm. No, that happens. But you keep track of it. And then you say, I'm worried about this, because the earlier we intervene, the better off kids are going to be. And the other thing that happens with young kids is trauma. You don't know what's going on at home. And so you just have to be really, really observant, pay attention, take lots of data, and talk to the kid. Kids will tell you. I mean, you can say, man, you're in a really bad mood today. What happened? And if they know, they'll tell you. It's okay. So what are the characteristics of kids with emotional and behavioral disorders? They have social skills deficit. They have poor social relationships, right? After all the things we've talked about, those things you would expect. Inability to cope effectively with the expectations of social settings. I think we all have that. Inappropriate expression of desires and needs. What do you think that looks like? What does that make you think of? Inappropriate expression of desires and needs.
That makes me think of like a temper tantrum.
That's exactly what I was thinking. That's a nice way to say they have tantrums, right? Lack of social competence, delinquency, trouble with the law, non-compliance. It's really important that when you work with children who are non-compliant, that you remember it's not about you. So if you tell a child to sit in his chair and he tells you no, and you take it personal, how are you going to react? If you think it's all about you, he just said no to me, and I am the teacher. Are you going to react in a calm way? No. You
I
have
probably just put them in the quiet corner for a timeout.
You got to go, dude. You automatically have to think, what is he communicating to me? Not, what did I do to him? Why is he mad at me? Why is he treating me this way? It's not about you. It's about him. What is he trying to tell you with that behavior? And what do you need to teach him so that he'll know how to communicate differently? Anxiety and depression we talked about. So prevalence, about 1% of the population, children with emotional and behavioral disorders. That's what people say. The actual prevalence is estimated to be between 3 and 6%. It's disproportionately male, which is a problem because it's not really. That's false positives, right? Overdiagnosis. Asian American and Hispanic students are underrepresented in the category of emotional and behavioral disorders, and African American students are overrepresented. What does that tell you about our diagnostic system? Do you think that Asian American students have less emotional and behavioral problems as a population than the rest of the population? And do you think that African American students are truly more emotionally and behavioral disordered than everyone else? No. Those numbers are wrong. In schools, that's what it looks like, but that's another thing that needs to be changed, and we've worked on it for years. But again, when I'm long gone, you're going to be out there watching. Why did we just say that this child has an emotional behavioral disorder? What's happening? You have to be really careful with those labels, right? I mean, we want to make sure the kids get the services they need, but if they don't need the service, then you don't want to put them in that category. Why do you think that is? Why do you start with the overrepresentation? Why do you think that African American students are overrepresented in the category of emotional and behavioral disorders?
I guess it could be like misunderstanding of like a behavior in their culture, where it could just be seen as like disruptive in a classroom setting, and the teacher might just not want to deal with the, like I said, the cultural difference.
Yeah, it could be a cultural difference. It could be straight up bias on our part, right? On teachers. A majority of teachers are white women, right? So maybe they don't understand cultural. Maybe they have implicit, maybe they have explicit biases. Lexi?
I was just gonna say racism.
Maybe it's straight up racism, right? I always think this is so much more clear when you compare, when you say African American students are overrepresented and Asian American students are underrepresented. It just jumps at you, the bias, the expectations, what people think, right? And so as a teacher, it's really hard to sit in a classroom with a kid that's just destroying your classroom. But you have to really back up and think, what is it I'm seeing? And is it cultural? And is it my biases? You have to reflect on yourself, right? I was going to tell you something and I just forgot it. African American students. How does this relate to what's going on in the world today with police, or what's being discussed in the world today? It's not something new. And why are we so uncomfortable talking about it? Talk to me. Do you think it's systemic? Yeah. Do you think you play a part in changing it? Yeah. In what way?
If we're able to recognize like our implicit and explicit biases as students and then apply them or work against them as teachers, then we can slowly start to change the system from the inside.
Amen. That's our job. That's our job, is to be very careful with ourselves and to do no harm. Okay. So what causes emotional and behavioral disorders? People don't know. It seems like I tell y'all that every week, but we don't know what caused that. There's 3 areas. People talk about biology. So we know that some mental illnesses, mental health disorders are genetic, right? Or we think that. We don't know that for sure. We know that emotional and behavioral disorders are impacted by home and the community. What's going on? Is there trauma happening? We also know that it can happen at school. You guys were talking about bullying a minute ago in middle school, right? It can definitely lead to depression and anxiety. And then how do we prevent it? Well, the first thing we do is we look at positive behavior supports in the school. So we're positive. We respond to positive behavior with positive reinforcement, as opposed to constantly punishing. We'll talk about FBAs, not today, but Thursday. We'll talk about reducing the overrepresentation. How can we do that? And then medical management is not our responsibility, right? We are not medicating. The part that you will play in management of medicine is if you see something different, you're going to notify a parent, right? If you think meds are changed or doing something, changing kids' behaviors that the parent might not notice. So I'm going to stop there, or else I'm going to finish this whole lecture today. You know why? Because you were so quiet. Not my fault. Oh, questions? Yes, Lexi.
Would destigmatizing the ideas of mental health also help as like not prevention,
It would
but
help with
just
prevention.
help the situation?
It would help as prevention too, right? If it became okay to say, my child is depressed, right? So when I was finishing my PhD, they had just started doing tier 1 screening. Did I tell you guys about this? So there's instruments. The one we were using was called the Basque-Bess, but it's just like 7 questions, I think. And every teacher would rate every one of their students. And it was mental health indicators. So it was indicators of depression, anxiety, ADHD. And she would just rate kids. And then we would score them so that if kids came out in the at-risk category based on the scoring, then services would be provided. Just like we do hearing screening, just like we do vision screening. How do you think parents responded to that? Or respond to it today? No, Erin, tell me why you think they didn't like it.
Just because I know if my mom got that kind of screening or my dad, they'd probably be like, first, we don't believe you and we want a professional's opinion, but we just don't believe you. Like, it's not possible.
Yeah. Yeah. There's so much stigma, and that goes back to what Lexi said. It's about stigma. It's okay if you say, I can't see. You can send that note home and say, this student can't see. But if you send a note home that says, we want to implement an intervention with Johnny to work on his aggressive behavior. What do you mean by that? Right? There's a story, there was a teacher that I worked with who, she was so funny. She was the first African-American teacher in this very small, very country city in Texas. Town. Is it a city? It's a town. And so these 2 little boys got in a fight, and they really fought. And so she punished them. And she said that afternoon, you'd have to hear her tell this story. This big man in overalls, this big white man in overalls came to the room, and he was angry. And he said, you will not punish my child for fighting. I taught my kids to stand up for themselves, and he's going to hit back every time somebody hits him, blah, 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 right? And so she always talked about that because the boy that the dad was talking about got killed in a bar fight when he was 18. He was fighting. But the cultural norm was that that's how you took care of yourself. So that's when you walk that fine line between, as a teacher, where do we step into people's lives? Where is our responsibility, right? And so what I'll tell you is that our responsibility is what it takes to keep kids safe, right? Her response to that father was, he's going to get punished in my class every time he fights. And that's what we have to do. But we have to keep kids safe, and we have to address needs as much as possible, especially if you're in any setting. You will see more needs in special ed settings, probably, maybe not, but we have to address them. And you have to know what the policies of the school are, right? So that if you see a sign that a kid's going to hurt themselves, or they are hurting themselves, or anything else that you feel like they need help for, there's procedures in place of how you address those things. If they're being bullied, if they are the bully, you have to follow the procedures and make sure you know them. If someone's hurting them, right? All of those issues. Sounds like a lot of responsibility, huh? That's when to teach. It's the best part of teaching. It's the best part. It's about building relationships and taking care of kids. It's fun. All right. Other questions? We're good? Emily?
Not like a question, but I know I don't remember exactly who asked, but when they asked about like how if you're working with like smaller children and how to identify if they're having like depressive or manic episode, what works for me, and I'm not a professional or anything, but with my kids, instead of necessarily sitting down and asking them, because sometimes the question is kind of boggling for a smaller mind, it's the thumbs up, thumbs down with no other, I won't even ask them anything. I look at them, if they're looking out of it, it's thumbs up or thumbs down, and they'll respond thumbs up or thumbs down. And then I usually take it from there depending on how they're reacting to it. Because sometimes then after that, they come to me. But if it looks like they're not ready to necessarily go from there, I don't jump in because it almost seems inappropriate, but they will come.
They will. They talk. Kids talk. Yeah. I was thinking about when you said thumbs up, thumbs down. Oh, when I taught in the classroom with kids with emotional behavior disorders, the little ones, some of them wouldn't have even been aware that I was asking that question because they would get so just out of it. Yeah, different world, different thoughts. Okay. All right. Thanks for joining me on Tuesday. Thanks for reminding me to video or whatever this thing is, record. All right. I'll see you Thursday.
Bye. Thank you.
Thank you.
Thank you.
I'm gonna end this thing.